Bismillah wa salatu wassalam ala Rasulillah. Welcome everybody to this presentation. Today, inshallah, I will talk about a medication that entered in the pharmacy and we started to dispensing from outpatient pharmacy. This medication is growth hormone, somatropin injection or norditropin. Around this subject, I will talk about in brief first what is growth hormone, indications and doses, contraindications, interactions, undesirable effect, special warning and precautions. Then I will focus on preparing for injection. First, what is the growth hormone? Is a hormone made by anterior pituitary gland, and it has important role in training and recovery. It's responsible for increasing glucose uptake in muscles, enhancing protein synthesis in the liver and muscles, and breakdown of fat. Growth hormone is released primarily during sleep and during exercise. But somatropin injection or norditropin is a solution for injection under the skin, that means subcutaneous, in a multi-dose disposable pre-filled pen. It contains human growth hormone, somatropin, which is identical to the growth hormone produced in the human body, which is the active substance. Growth hormone can be comes in different forms, in a vial or in a pens in different concentration, but today I will focus on this product from Novo Nordisk company because that we have in the pharmacy. What are the indications and doses of somatropin? In case of growth hormone insufficiency, and the dose in this case is from 25 to 35 microgram per kg per day. And in children with Turner syndrome, what's the Turner syndrome? It is a chromosomal condition that affect woman development, and women in this condition tend to be shorter than average. Also, they have extra skin in the neck and have kidney problems. The dose in this case is from 45 to 67 microgram per kg per day. And also, growth hormone can be used in case of in children with chronic renal disease, and those in this case is 50 microgram per kg per day. And in case of children born small for gestational age, the dose is from 33 to 67 microgram per kg per day. There are some contraindications of growth hormone, like if there is any evidence of active malignant tumor, and in case of pregnancy and lactation, and in patients with acute critical illness. Interactions with other medications, concomitant glucocorticoid therapy may inhibit growth and counter the growth hormone or growth promoting effect of somatropin. On the other hand, the effect of growth hormone on the final height can be influenced by additional therapy with other hormones like gonadotropin, anabolic steroid, estrogens, and thyroid hormone. There are some undesirable effects of growth hormone like joint pain, swelling feet and hands, and rash, muscles pain, and headache. Let's focus on preparing of norditropin for injection. I will talk about first how you can calculate the dose, then how you can check if the pen is work probably or not, then how you can adjust the dose on the pen, and finally how you can inject the dose. First, you have to memorize these numbers. 1 milligram of growth hormone is equal 3 international units. That's mean 1 international unit is equal 0.33 milligram. And in each leaflet you will find a table, conversion table, that will be convert the dose in milligram to the number of clicks. Like this prescription the doctor wrote for units that's equal to 1.33. When you refer to the table, you will find that 1.33 is equal 20 clicks. Then let's talk about how you can check if the pen work probably or not. First, pull off the pen cap, then screw the needle, and the third step is check the flow. And this is you have to do it before when you use a new pen for the first time, and it's called priming the pen. And this is important to sure that you inject the proper dose and don't inject any air. How you can do this? Hold the pen with the needle directly upward, and then by your finger tap the container gently, and you will see all air bubbles will go up at the top of the container. Then turn the pen, the cartilage, the container this direction, as you can see, until you hear one click, and you will see the push button will rise little. Then press the push button, as you can see in this picture, until the growth hormone appear at the top of the needle. If you don't see the drop of the growth hormone on the needle, that means the pen not work probably. And then setting the dose, how you can adjust the dose on the pen. First, the pen contains two scale, pen cap scale and push bottom scale. And there is indicator also to indicate the number of clicks on the pen cap scale. For example, we want to adjust 20 clicks. As you can see in this picture, turn the pen cap scale on this direction and make one full turn, and you will find the push bottom. There is a number of on the push bottom is equal to 5. That means 5 clicks, and we need 20 clicks. So make another turn, and the third turn, and the fourth turn, until number 20 appear on the push bottom. And you then hold the pen on this direction to make sure that you adjust the dose 20 click. The third or the last step is how you can inject the dose to the skin. The injection consists of two steps. The first step is inserting the needle into the skin, and the second step is to press the push button to inject the dose. After the injection of growth hormone, the needle should be remain under the skin for at least 6 seconds, and keep the push button fully pressed down until the needle has been withdrawn from the skin. This will to ensure that the full dose has been injected. After injection, replace the outer needle cap and screw the needle carefully and disposable in for safety reasons. There are special warning and precautions, like don't use growth hormone if the growth hormone solution in the pre-filled pen doesn't appear water clear, colorless, and to make sure you get the proper dose and don't inject air. Check the flow, and as I told you, it's called priming the pen before the first injection. And regarding the storage, Norditropin should be stored at from 2 to 8 degrees centigrade in refrigerator. Avoid freezing. Once open, can be stored for a maximum of 28 days in refrigerator. And thank you for listening.